Good morning, everyone. My name is Toyin, and I'm going to show you how we carry out a midnight insertion for our patients in our hospital. First and foremost, I'm going to show you all the items that you're going to need to carry out this procedure safely. So first of all, you will need a dressing pack, and in the dressing pack we have your gauze, we have your sterile dressing, and we also have a tray where you can put in your disposable sharp when you finish, so that you can dispose your sharps off safely. So you will also going to need extra gauze for this. You're going to need extra dressing, except if your pack comes with 2 dressings. You're going to need 2 3-way taps. You're going to need an extra sterile dressing. You're going to need 2 packs of ChloraPrep, which is to clean the area where you're going to insert the midline. You're going to need flush, 2 sterile flush in a pack. I always add additional 2 just in case you need to flush it to make sure the access is clear. You're going to need lidocaine. Here we do use 1% lidocaine. The one I'm holding at the moment is 5 ml, because before insertion we administer 1 ml each on each hand, just to make the patient comfortable before inserting the line. We need a syringe. You can either use 2 ml syringe. This is just to draw your lidocaine, or you can use 5 ml syringe. You need your subcut needle. We use the safety one here in this hospital. You also need your needle. This is just to aspirate your lidocaine from the ampoule. And you also need a probe cover. This is a sterile probe cover that you will need to put onto your probe before commencing to do the procedure. You're also going to need a sterile tube, a sterile gel, and this is it. This is the sterile gel you use. So we use 1 for each patient, and we dispose afterwards. So those are all the things you're going to need for the midline insertion. So I'm going to start now by preparing the tray, and I'm going to show you how we do that. As you can see, I have already started opening up my pack, and in the pack that I opened earlier, we have this tray that I told you is a sterile tray. We have a sterile tourniquet, we have our sterile glove, we have our sterile gauze, we have our sterile dressing paper, and we also have our sterile dressing paper. This is kind of like waterproof one that we will use both as well. You will see it when I start the procedure. You will see how I place those. So now I'm going to open the other items. So because we are doing 2 today, I'm going to open extra dressing. This is a 3000 IV dressing. You can use any one you use according to your trust or wherever you are. So I'm going to open my syringe. This is a cup, my needle, subcut needle. I'm going to open my and this is my 3-way tap. Depending on any other one you use in your trust. For here, this is the 3-way tap we use. And this is my lidocaine, which I'm going to place in my tray. And this is my 3 ml ChloraPrep that we use to prepare the area, to clean the area. It's got 2% chlorhexidine 20 milligram chlorhexidine inside. I think that's about it. So going to open another 3-way tap because we're doing it for 2 procedure, and an extra saline. And I'm just going to open extra gauze, which we're going to need. So we also need the red needle. I don't know what you call it in your truster. This is just for us to aspirate the right lidocaine into our syringe. And we have the gel here, which is for later. We don't need that now. Now I am also going to now open. This is my probe cover. Okay, we use 2 types of probe cover in this trust. Sometimes it comes with a gel and sometimes it comes at like this. This one I'm using today doesn't have any gel included, which is why I'm using the extra sterile gel. Okay, I'm going to start by just preparing the 3-way tap, putting in the saline into it, and the second one as well. I'm just going to prime. I'm priming my 3-way tap.
What are you doing there?
Tamara, Tams, can you get me Julie? I need midline. So I've primed both 3-way tap that we need to use, and I'm just going to open my midline here, which unfortunately I didn't have before. We're just waiting for the midline. So that was the only thing that wasn't included in the list of items that I showed you. So once they get me one now, I'm going to show you how one looks like. Give me 4. Thank you. So this is a midline, just for you to see what it looks like. So it's what is known as a deep access deep vein cannula. It's a deep vein IV catheter. It's almost like it's just like a catheter. It's just that it's deeper. It goes deeper, and you use it with your ultrasound when you want to access the vein. So this is what we do. We have this is an 18 gig catheter. That is what we use here. We have other sizes as well. We have 20, but we don't use 20 because it's too small for us. So there are different sizes, but for our trust and for the patients we look after, we use the 18G IV catheter. So I'm just going to open one now. For this procedure, I need 2, but I'm only going to open one now. When I'm ready to put in the second line, I will open the other one. So this is how you prepare your tray. So now I'm just going to aspirate my lidocaine. Using a 2 ml syringe. I've checked my lidocaine earlier. It's within date, expiry date and everything. I have checked it earlier. So in case you're wondering, no, she didn't even look. I've checked everything earlier. Anyway, I'm just going to now put my subcut needle and we are prepared, we're good to go. Remember, once you've dressed your patient's site after inserting the midline, ensure that you put the date of the insertion. This can stay up to 7 days once it's looked after properly. It can stay up to 7 days if the line is looked after properly. All right, now we're going to go to start the procedure. Okay, here, this is the ultrasound machine that I'm going to use for the procedure. I have cleaned my ultrasound and it's ready to be used. And this is just me putting it on. When I put it on, this is what you see. And I'm going to choose the probe that I want to use to carry out the midline insertion. And I'm pressing on probe. And I'm pressing on the one that says vascular, which is the blue one highlighted. I'm pressing on that. And I'm going to press on M, the letter M, which is just a green line that will show me the middle of the vein where I want to access. To start now, I'm just going to ask my patient to fold her arms just across the chest, just to have a clear space for us to lay all our items before we proceed. So if you remember, in my sterile tray, I took out this sterile paper, which is just to lay, to prepare the area where we are putting all our items for the procedure. And on top of this, I'm just going to lay a sterile paper. Then I'm going to lay my tourniquet, and then once I've done that, I'm going to ask my patient to bring her hands facing me. So I'm going to bring the hand back towards me and I'm going to straighten the arm. So after doing that, I'm going to take off my gloves and I'm going to pop on my sterile gloves on. Okay, I'm going to put the tourniquet. Before I put the tourniquet around the arm, I'm going to clean the area that I'm going to put in the line. So I'm just going to clean the area, if you remember, with the chlorhexidine 3mm. So now I'm going to put on the tourniquet around my patient. So,
are you going into one particular place?
I'm going to explain later. This is my probe cover, my sterile probe cover, which I'm going to use to cover my probe. So you apply your sterile gel onto your probe, and then you wear your cover onto the probe. It normally comes with 2 elastic bands, so you just use that and you make sure it's firm onto the probe, and then you place your probe on the sterile dressing. So now I'm just gonna put everything that I'm gonna need just beside me here. I think that's it. Okay. So I'm gonna put the gel on the upper arm. So to put a midline, the midline has to always be inserted in this area, which is the upper arm. So you either put it in the brachial vein or the cephalic vein. So depending on your picture from the ultrasound, then you will know where to put it. We have very good picture here, as you can see. So that is the artery pulsating. So you cannot put a line in the pulsating vein. So all those 3 dark circles you are looking at now, you can see quite a couple, 3, 4 circles. All those are veins and artery. But for you to identify your artery, you need to press down into the patient's arm, and then you're going to see that the artery is pulsating. So we cannot at any time put a midline into that. But we have very good veins, which you can see. This is one, round and big, and this is another one down. So from my assessment, I'm going to go to this one. Okay? So I've cleaned my area before. So I'm going to, that's a good and clear picture for me, and I'm happy. So, like I told you before, we do use lidocaine just to numb the area, make our patients comfortable before we insert the line, because this is a deep vein access catheter. So I'm just going to inject. So I leave like about a mil space between the line, and I'm going to inject the lidocaine into. I am injecting, and then aspirate just to see you're in the correct place. If you aspirate and you aspirate blood, you need to take your lidocaine out, because we don't want to put the lidocaine into the vein, but the surrounding tissue around the vein, to help the patient to be comfortable as much as possible. So I have assessed that, and that is fine. So I'm pushing in my lidocaine now. And you can see the way I'm pushing it. If you look, you will see it from the ultrasound. So I have done that. So what I do now is I just rub it in a bit for about a minute or so. Are you okay, my dear?
Yes, I'm okay.
Thank you. If you are uncomfortable at any time, let me know.
Right.
I'm going to start inserting the needle soon.
Okay.
If you feel any tingling in your fingers, please let me know.
Okay.
So we tell the patient that because when you are inserting the midline needle and they feel tingling, that means you're touching the nerves. You should immediately remove it. So you always tell your patient that once you want to start the insertion, that if you feel tingling in your finger, let me know. Okay? All right. So that's okay now. Okay, all right. So sometimes when you do give your patient lidocaine, you see your vein will shrink a little bit. So this is the vein I'm going to, like I show you, nice and juicy. And if you press it down, you can see your artery pulsating. So I'll just say, just do one light check before you go in, so you know where you're going. And if you remember, I told you the line, the green line in the middle, serves as a guide for us to know that we're going into the appropriate space. So I'm going to go in now. Okay, so I'm going to go in now. Are you happy for me to proceed?
Yes, please.
Thank
you.
So I'm right, the line is in the middle, and I'm going to proceed now. Okay, and I'm going into the brachial vein. So go on. You can see as I'm going, you can see, and when you're going, it's always good to go at a 90 degrees, which I'm doing now. I'm going at angle 90. I'm right at the top. I'm inside now. So once you're inside, you're going to see blood aspirates in your needle. Okay, so then you will see me go like an angle 30, and I'll just go in a little bit, and I'm putting my probe down, and I'm going to just push my needle in, and we are done. So the first and foremost thing you're going to do is please release the tourniquet around your patient and clean the gel around the area. Okay. And then you put your gauze just underneath, and then you get your 3-way tap and your saline, and then you just cap onto it. So you aspirate. This is a very good line, as you can see, and then you push it back in. So just clean the area. And now all I'm going to do is I am just going to dress it. So this is a sterile dressing, IV 3000 that we use in this trust. Yeah. So before I complete, I am going to aspirate and flush the line again, because sometimes when you put your dressing on the line, you can see a bit of restriction, so that you can adjust and make sure everything is in place before you leave your patient. So I'm just going to aspirate and flush the line again, just to make sure our line is fine here. That's very good. I'm happy. So you're going to close it off at a positive, so which is what I'm doing now. Push, close. So that's fine for me. I'm happy. So I'm just going to close this now. Then I'm going to just remove my dressing. And then you put your date on. So that is the end, and then you make sure you put your needle away. So if you are dressing the other side, you just make sure you change this dressing, and you keep everything as sterile as possible. If you lift your hand up for me, thank you. Put it across your chest, just relax it on your chest, and we're good to go, we are fine. So that's everything. That's how to insert a midline insertion. Any questions? All right, thank you.